Hello, my name is Dr. Trevor Lindgren at Copper Mountain Dental. I just wanted to give you another Tooth Talk Tuesday today to give you some ideas on how to prevent gum disease. Gum disease is the second most common reason why people lose their teeth, second only to tooth decay. And gum disease is a common reason for teeth to eventually get loose and fall out and requiring you to need dentures or partials or implants. And so gum disease is a significant problem, and it's estimated that around 60% of the US population has some form of gum disease. The gum disease comes in a spectrum. It starts out as what's called gingivitis, which is mild inflammation of the gums. You can have mild inflammation or mild gingivitis, or you can have severe inflammation or really severe gingivitis. And there's a really severe form of gingivitis called ANUG, or acute necrotizing ulcerative gingivitis, or ANUG. And we don't see ANUG in very many people unless you're under a lot of significant stress. I see it sometimes in college students who are undergoing final exam week and they haven't had time to brush their teeth, and they haven't brushed their teeth for a few weeks, and they're just studying frantically to get ready for final exams, and they get severe ANUG. There goes from a spectrum. Like I said, it starts at mild gingivitis, moderate gingivitis, severe gingivitis, and then sometimes it goes from there to what's called periodontitis. If gingivitis or inflammation in the gums is left untreated for many years, what can happen is it can turn into what's called periodontitis. And periodontitis is a gum disease that affects not only the gums, but also the bone that surrounds the teeth. And the bone that surrounds the teeth and the gums that surround the teeth is subject to inflammation for so long. This chronic inflammation causes your body to react in a way that's not good. The chronic inflammation from the bacteria around your gums causes your body to react in a way that makes the bone slowly dissolve from around your teeth, so the bone will lower and your teeth will become more exposed and the root surfaces will become exposed. You get recession where you have exposed roots, and your teeth will eventually get loose and fall out if not treated. Now, this process of periodontitis, where you lose bone around your teeth, can happen over many years. It usually takes years to happen. People who haven't had their teeth professionally cleaned at a dental office for many years can end up with periodontitis. But there's rare forms of periodontitis that can happen more quickly, even in teenagers or young adults, where you can get severe periodontitis or severe bone loss in a short period of time in people who have a certain genetic predisposition to getting gingivitis, or if they have a certain type of bacteria in their mouth that makes it where the periodontitis happens at a faster rate. So gum disease is something that is preventable, and it is very treatable as well. Even if you have moderate gum disease, or sometimes even severe gum disease, can be treated with a professional cleaning at a dental office. Having a hygienist or a dentist or a periodontist or a gum specialist clean your teeth thoroughly is an effective treatment to help put the gum disease in remission. Gum disease is not anything that's ever really cured 100%, but if you get a thorough cleaning done with a professional, having that cleaning done can make it so that the gum disease can be in remission, and you can have stable, healthy gums for many years and hopefully never lose bone again in the future, or at least slow down the bone loss so it's very, very gradual. So it's really important to get your teeth cleaned on a regular basis if you have gum disease. And some people can go with gingivitis for many years and never get periodontitis, depending on the type of bacteria or your genetics, but it's impossible to know that unless you get your teeth checked on a regular basis. So what I'm advocating here is that you come and see us at Copper Mountain Dental and have us do a check and check your gums and your teeth, and we can have our hygienist or myself clean your teeth and help you prevent gum disease that can lead to bone and tooth loss in your mouth. So the good news is that periodontitis has a good prognosis if treated early, and if you take good care of your teeth and if you start to come in faithfully for your regular cleanings, then it can be treated well, and you can put it in remission to where it essentially doesn't really affect your teeth anymore, other than you may have lost a little bit of bone. You can never gain that bone back is the problem. So once you've lost some bone due to gum disease, you can't really gain that bone back, especially if it's horizontal bone loss, but you can have it treated and make it so that you don't lose more bone in the future. And if the bone loss is isolated to one little pocket, sometimes there's procedures a gum specialist can do to help you gain bone back in certain instances. So give us a call and come let us check your teeth and your gums, and let us know if there's anything we can do. If you've had any symptoms of gum disease, if your gums bleed a lot when you floss, if you haven't had a cleaning done for a long time and you have buildup or tartar on your teeth, especially the lower front teeth is where it tends to accumulate most often, we can help you get your teeth cleaned and help you prevent gum disease so that you can keep your teeth and gums healthy. It's a kind of a tragedy when someone could simply get a good dental cleaning done, but because they haven't had that cleaning done, then they end up losing their teeth. And I don't want that to happen to you. I've seen that happen before, where people lose their teeth because they haven't just done the regular maintenance of getting the regular cleanings done. And if you did the simple things of just getting simple, painless, cleaning done with a good hygienist or dentist, then you can prevent gum disease. And you can do things at home as well, of course, brushing and flossing thoroughly, using an electric toothbrush, using flossing your teeth, or using a water flosser like a Waterpik is also helpful for preventing gum disease. There's also mouth rinses like Listerine. There's prescription mouth rinses like chlorhexidine. There's lots of different mouth rinses and brushing and flossing that you can do, but the most important thing is to physically remove the plaque from your teeth with the flossing and brushing, and that physical removal of the biofilm is what helps you treat and prevent gum disease. And the plaque and biofilm that calcifies and hardens on your teeth can't be removed unless you have a professional help you do it. So that's why it's important to come in and get your teeth cleaned professionally on a regular basis. And that's why we do cleanings every 6 months, because tartar can build up in that short period of time, and also cavities can form between your teeth in that short period of time. So that's why we do it on that regular of a cleaning schedule, so that you can keep your teeth healthy and clean and not develop that chronic gum disease where you start to lose bone. Thank you so much for watching. I appreciate your time, and I hope you have a wonderful day, and please give us a chance. We'll give you the opportunity to help prevent gum disease. Thanks again. Have a great evening.